All right, everyone. So we will probably get started about now. So welcome. I would like to start by acknowledging that wherever we're meeting today, we pay our respects to the traditional owners of the land. We would like to pay our respects to their elders, past, present, and emerging. And I extend those same respects to any traditional owners who may be joining us today. I would also like to acknowledge that Vasan Srinivasan and Jim Gooden, the Chair and Vice Chair of the Mental Health Foundation Australia, respectively, are both joining us and watching today. So thank you both for coming. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health. It is an important time where the Australian community comes together to raise awareness that #mental health matters. Throughout this month, many events have been organised in each state of Australia, aiming to attract and unite Australians of all ages and backgrounds and raise awareness of mental health for all. So without further ado, let's together watch the journey of the National Mental Health Month.
A journey of 1,000 miles begins with a single step. Mental Health Foundation Australia's journey began 90 years ago. It dawned in 1930 with just a founder and vision, which was to reach and impact Victoria. Now we have a presence in all states and changing lives for over 100,000 people throughout Australia. Our organisation's biggest initiative yet is our National Mental Health Month. Our month-long initiative is to advocate and raise awareness on Australian mental health. Our vision is to recharge and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With the theme being Mental Health Matters, the awareness is cumulative. In 30 events we have organised to reach the community in all mental health subject matters affecting our lives today. To further continue our journey of 1,000 miles, the Walk for Mental Health has transitioned from a Victoria-only walk to being a nationwide community walk, where anybody from anywhere in Australia can connect with us and walk with us virtually to spread the impact and awareness of mental health. We pride ourselves with making sure all our programs are for the community and are powered by the community. We have a vast growing network of multicultural ambassadors who are part of our program to further the community voice in promoting positive mental health and wellbeing. Our multicultural network has inspired our educational and multicultural webinars as an initiative to help power Fidelity to cope with success during the pandemic, to promote the understanding of unique cultural and ethnic heritage in Australia and the development of culturally responsible and responsive curricula. The Mental Health Foundation of Australia conducted the multicultural research to continue on the development of the fast-growing multicultural fidelity in Australia. With the effects of COVID-19 pandemic, the MHFA has successfully committed the Power Hour of services and the reach to the community. With the helpline hours extended, we are here to show Australians we can be a shoulder to lean on and can be dialed to assist in all mental health matters. Our impact flows into the COVID-19 meal delivery response with the help of the community, local business and our multicultural ambassadors. It has promoted one vision, which is to serve others before self during this time of uncertainty. With over 45,000 meals delivered, we continue to work with the Department of Health, the Human Services, the Salvation Army and the Australian Multicultural Foundation to continue the success. As we continue to work to deepen understanding the importance of mental well-being and educating the community, let's work together to bring better mental health for all.
So I would now like to introduce our first speaker for the day. Martin Kravosha will be talking to you about his time at the Foundation and the Mental Health Foundation Australia's youth programs. So Martin is a lawyer currently working in civil litigation and insurance law, having also worked in a number of industries, including volunteering at a family education and support not-for-profit, Martin has experienced communicating and interacting with people from all walks of life. During this time, he has developed a keen interest in the Mental Health Foundation of Australia and its initiatives. In his free time, Martin has various hobbies and endeavours, including computer programming, camping, and sport. He also chairs our Youth Ambassador program and has worked closely with the Mental Health Foundation of Australia to prepare the Youth Policy Paper, which will assist government in forming appropriate policy to address youth mental health as advised by the youth community panel discussion members. Please welcome Martin.
Thank you, Natalie. Hello, everyone. Thanks for the introduction. My name is Martin Kravosha. I am the chair of the Youth Ambassador program, and I'm proud and honoured to be part of the Mental Health Foundation along with my fellow youth ambassadors. So we're here on day 2 of Mental Health Month. It's great to see so many people joining us today. And look, on behalf of the ambassadors and the youth committee, I'd like to thank all the presenters today and the panelists attending. Your effort and support for joining us is greatly appreciated. The Youth Ambassador program is open to all members of the community between the ages of 16 and 25. It's all about identifying key issues that Australian youth are dealing with, spreading awareness of these issues, and really leading initiatives to assist the Australian youth with their mental health challenges. The Foundation runs a number of support groups, including those targeting the mental wellbeing of young people. And that's an ongoing process that's undergoing development and increased support over time. The youth of today really face significant pressures from their family, schooling and work life. And often the 16 to 25-year-old age period is really a time of great transition. This is really the reason why myself and my fellow youth ambassadors, along with the Mental Health Foundation as a whole, really diligently work on creating and promoting initiatives to help spread awareness around youth mental health and assist in helping the youth around Australia know that they're not alone, know that support is available, and that we, the Australian community, in all its branches, are here to help. I would like to thank the youth ambassadors again for dedicating their time to these goals. And without further ado, I can pass across to Mike Hutton, Squire from Australian Unity.
Right. Hi, everybody. Hope you can hear me okay. Martin, thank you very much for your introduction and your words. And good afternoon to everyone who has joined us here today on this important topic of youth mental health. I'd firstly like to start by acknowledging the traditional owners of the various lands on which we are meeting, and I pay my respects to their elders past and present. I also wanted to offer my condolences to those who have lost family since the beginning of the COVID-19 pandemic. My thoughts and support go out to all those families. And for those of you who don't know me, my name is Mike Hutton, Squire. I'm the Executive General Manager for Health Services at Australian Unity and one of the major sponsors for the Mental Health Foundation of Australia. I do also want to acknowledge the work of the Foundation and their great work in the mental health space. This is Australian Unity's second year of involvement with the Foundation, and we really look forward to tackling some of the most challenging social issues together. Mental Health Month, held in October each year, gives us an opportunity to raise awareness about mental health and well-being. It's also a chance to promote activities and ideas that can have a positive impact on our daily lives and the lives of others. Today, I've been asked to speak with you about youth mental health. It is a subject that is very close to my heart, as I have a teenager who has spent considerable time in hospital this year due to his mental health challenges. And I know all too well how highly invasive mental health conditions can be and how they can be destructive, not just to the individual, but to a whole family, a community, and can rob everybody from happiness, sometimes without any meaningful end in sight. And I think in particular, this year has been perhaps the most challenging. The outbreak of COVID-19 will likely have long-term and profound impacts on youth Australians' mental health and well-being. In fact, according to the Royal Australian College of General Practice, antidepressant prescriptions have increased by 30% year on year, which is an astonishing amount. In another article published in the Canadian Journal of Psychiatry, it highlights the substantial deterioration in youth mental health since the beginning of the pandemic this year. In their study, nearly 70% of youth researched met the screening criteria for an internalizing mental health disorder. And with restrictions on school attendance and the usual socialization components that are so critical to being a young adult, we have to do more to look after our youth. While the pandemic impacts school attendance, another byproduct is emerging for our youth. Cyberbullying has been reportedly increasing by 70% as well during this pandemic. So over and above the severe economic impact felt by the pandemic, it is perhaps the mental health impact that will be felt much greater and for much longer as our young people overcome what has occurred in 2020. In my career, I've worked extensively in the technology and digital space. And while our technology and communication has made everything so much more accessible and immediate, like working and schooling from home, we've seen the proliferation of digital channels now means bullying can extend anytime, anywhere, outside school hours, into home and personal lives, and can have substantial impact on absenteeism from school. And as we now look forward to returning to physical school and university, for young Australians, school and university is the place for academic, social, and cultural engagement. It's where we learn skills for our future careers. It's where we spend time with our mates, and it's where we learn about our local and global environment. As such, schools and universities should be safe and encouraging environments where we can do all this. There is a growing understanding that if educators are more aware of the link between increased absenteeism and diminishing mental health, more can be done to intervene and provide treatment. Assisting students to address mental health and well-being may in turn help prevent the emergence of chronic absenteeism. At the same time, working to help students who are showing signs of chronic absenteeism attend their place of learning consistently may also prevent ill health and poor well-being, both now and into the future. It is so important for you as the future generation of leaders to keep having these conversations between yourselves and your teachers, family, and support mechanisms wherever you can. And there is also more work we need to do to close the gap between Indigenous and non-Indigenous Australians and improve youth mental health and well-being of all Aboriginal and Torres Strait Islander Australians. Aboriginal youth experience a suicide rate that is double the non-Indigenous rate. And so as a nation, we need to improve our efforts to address these inequalities and not just close the gap, but exceed the gap. For a long time, Australian Unity has recognised the importance of high-quality mental health support services. And in 2015, after conducting a global search, we adopted the UK's National Health Service model of low-intensity behavioural therapy. Working with Flinders University in South Australia, we contextualised it to the Australian market and adapted it for a more acute clients who have just been recently hospitalised and discharged. The program now directly addresses the challenges associated with increased healthcare utilisation by enabling people to recover from anxiety and depression in their own home and staying recovered. Results from our intervention have shown encouraging results and have been published in a peer-reviewed journal as evidence that the intervention delivers recovery rates of nearly 60%. The program's evidence of success is important in the Australian healthcare context to provide linkage between primary care and acute care. A national model of stepped care between various settings is needed to ensure Australians don't bounce in and out of the healthcare system, but develop skills for self-management of their mental health that can last their lifetime. Furthermore, lived experience and evidence-based interventions are crucial in ensuring public and private health dollars are appropriately utilised and that low-value care is removed. Australian Unity is also demonstrating its ongoing commitment to the mental health and well-being of Aboriginal Australians through its recent investment in the development of a program called Healing Minds. And this is an initiative that is jointly developed by Australian Unity's Indigenous Services business and Remedy Healthcare, another healthcare division of the group. And it leverages our existing experience in mental health as well as in Aboriginal care. Australian Unity established the Indigenous Services businesses in 2018 to provide culturally appropriate care and to develop improved services for Aboriginal and Torres Strait Islanders. The program commenced in July 2020 and will be rigorously analysed to determine the improvements it is delivering for Indigenous people, and we will then go on to adapt the program for culturally and linguistically diverse communities and respond to their growing needs for mental health support. In closing, Mental Health Month is an important opportunity to raise awareness about the impacts of mental health and the range of supports available that can improve someone's sense of well-being. I am committed to ensuring that we develop and continue to innovate new ways for people to access and receive effective treatments that work to alleviate their mental health symptoms. The scale of the issues of youth mental ill health, including bullying, cyberbullying, absenteeism, requires a holistic approach to affect behavioural and ongoing change in our society. It's important to acknowledge the important roles that school and universities have in the prevention of declining mental health, as well as being important partners with students and parents in responding to these occurrences. Together, we all play a vital role in building and promoting positive mental health strategies in our communities. And I encourage you as the students and future generation of leaders to start, engage, and contribute with these conversations. We must maintain focus on adopting services and programs that are grounded in evidence and have long-lasting, meaningful impact to people's mental health, not just the feel-good factors that might be fashionable on the day. I thank the Mental Health Foundation of Australia for their unwavering commitment to improving the better mental health for all Australians, including youth, and I thank you for the opportunity to speak with you today.
Thank you so much, Mike. Everything you just said is so important, and it's really wonderful to be hearing about that and all the great work that Australian Unity is doing. Just for a bit of background on Mike quickly, Mike Hutton Squire joined Remedy Healthcare in 2012 and became Executive General Manager in 2018. His prior experience as senior leader in both the UK and Australia across multiple industries, including legal, finance, public relations, technology, insurance, aged care, pharmaceutical, and healthcare. Mike is experienced in strategic and operational management of multi-million-dollar projects and P&Ls with a strong focus on redevelopment. Mike has been responsible for multiple business acquisitions and integrations, large dispersed workforces, and has a keen understanding of how to successfully operate, optimize, and grow business operations in rapidly expanding industries. So thank you so much once again for speaking with us today, Mike. I'd now like to introduce Natalie Russell from Vic Health, who will be giving you an address on youth mental health issues and Vic Health's work in the field. Natalie is a Principal Program Officer in Mental Health at Wellbeing at Vic Health. Natalie has 20 years experience, nationally and internationally in public health and health promotion, including 9 years working in gender equality and the primary prevention of violence against women. Natalie holds a Bachelor of Health Promotion and Health Services Management and a Master of Public Health, and provides leadership and expertise in gender equality at Vic Health. Natalie's current portfolio of programs include masculinities and health, and a focus on youth engagement for social connection and well-being outcomes. Please join me in welcoming Natalie to speak.
Great, thank you, Anjali. Good afternoon, everyone. I too would like to start by acknowledging the traditional owners of the many lands which we meet on today, and pay my respects to elders past and present, and any emerging leaders among us today. I would also like to acknowledge ministers, parliamentarians, and any other dignitaries on this meeting. I too would also like to congratulate the Mental Health Foundation of Australia for its unwavering commitment to keeping mental health on our radar. So if you could please change to the next slide. So the burden of mental ill health is significant and not decreasing. Despite a major increase in treatment availability and uptake, This has not reduced the prevalence or impact of mental health conditions in almost 25 years. And indeed, the prevalence of these conditions is increasing, particularly among young people, and particularly as a result of the pandemic. So Vic Health recently surveyed 2,000 Victorians about their health and mental wellbeing during the first lockdown. And we found that almost 1 in 4 Victorians didn't feel socially connected to others, and this was up from 1 in 10 before the pandemic in February earlier this year. 1 in 6 were worried about being able to put food on the table, again up from 1 in 11 in February earlier this year. And 2 in 5 were less physically active in the first lockdown than they were in February. So many Victorians were already fighting an uphill battle before the pandemic hit, but now they're facing even greater challenges when it comes to putting healthy food on the table, keeping active, and staying connected to their friends and family and others in the community. All of these are precursors for mental health conditions. In this time of great health challenge, it's important to address the urgent needs of our communities, and Vic Health has done this by supporting local organisations such as sports clubs and sports leagues, arts organisations, community gardens and theatre, and other community groups, as they really are the social key to the coronavirus recovery. But it's also important to look ahead beyond coronavirus and toward the building blocks that will strengthen our individual and collective mental wellbeing and prevent future mental illness and promote mental health and resilience into the future. If you could change slide, please. So to this end, Vic Health recently completed a review of the strongest evidence on the primary prevention of mental health conditions. The evidence review asked 2 key questions. Can mental health conditions be prevented? And can this be achieved through primary prevention activity? Well, the simple answer to both of those was yes. But in regards to what the study actually found was that, well, according to recent burden of disease studies, at least 21% of the burden of disability and premature death associated with mental health conditions is preventable. The evidence review found that it's possible to prevent the onset of mental health conditions by reducing people's exposure to risk factors and increasing their exposure to protective factors for these conditions. There are a considerable number of risk and protective factors for mental health conditions, with major risk factors including child maltreatment, family violence, bullying, racism, loneliness, and socioeconomic disadvantage. The current evidence shows that primary prevention requires a multimodal approach that targets multiple factors in the settings where people live, learn, work, play, and age. Next slide, please. So since a large proportion of mental health conditions commence in childhood, adolescent and early adult life, it's important to implement primary prevention initiatives early in these stages of life. The challenge now, as we move into a very impacted world because of the pandemic, is that we must continue to hold the line on using evidence-based initiatives to scale across the population. We must continue to build the emerging evidence base around what works to prevent mental illness and promote mental health. And we must ensure we do this with equity and inclusion at the fore so that no one is left behind. We must also ensure that we do this in partnership with leaders such as those that are with us today. And that includes the younger generation. So it's only through coming to events such as this with strong coalitions, such as those represented today, that we can begin to focus on what complexity lies ahead in the future prevention of mental ill health and a stronger promotion of mental wellbeing. These are the building blocks of a more resilient community, and we thank the Mental Health Foundation for being such an important leader in this space. So just on my final slide, if you could please change. I just want to mention that Vic Health has recently announced $2.5 million in grant funding to support Victorians to create meaningful social connections, get active in a restricted environment and access healthy, affordable food. So to address all of those priorities that we are seeing as important considerations in the data around Victorians' mental wellbeing. So if this is of interest to you, please visit our website and look at the Reimagining Health grants. Applications close on the 27th of October, But importantly, we've made it very accessible to a range of organisations to apply for funding, in that the funding application should take only 30 minutes in its entirety. So I encourage you to check that out, and also check out the evidence review on our website. Thank you for your time.
Thank you so much, Natalie. It's really great work that you're doing, and it's really wonderful to hear about all of that. Now we will be watching a pre-recorded message from the Honourable Ross Spence. Ross Spence is an Australian politician, and she has been a Labor Party member of a Victorian Legislative Assembly since November 2014, representing the electorate of Europe. Spence has served as the Minister for Multicultural Affairs, Community Sport and Minister for Youth in the Andrews Ministry since March 2020. Please, this might take a minute to get up the pre-recorded message, but you will be hearing from her in just a moment.
Hello everyone. I wish to begin by acknowledging the traditional owners of all the lands on which we meet today across the state, and pay my respects to elders past, present and emerging. I would also like to acknowledge any young Aboriginal leaders and other Aboriginal people who are joining us today. I'm delighted to be speaking to you all during National Mental Health Month, and I congratulate the Mental Health Foundation Australia for initiating this important campaign. Thank you for inviting me to be a part of today's forum, and I'm sorry I can't be there in person. Never has the issue of youth mental health been more at the forefront of our minds as a community and as a government. Young people continue to show enormous resilience and strength in the face of unprecedented challenges. Across Victoria, young people are doing the right thing and staying home to keep themselves, their friends and their families safe from coronavirus. Because of this, we know that many young people are feeling lonely, anxious and disconnected from their friends and social networks. In light of this, young people continue to show leadership and determination in solving complex social problems like mental health. Listening to young people with lived experience of mental ill health, no matter what form it takes, is crucial. I've heard many courageous stories from young people who have asked for help but been let down by the system. Young people have extremely valuable experiences and can contribute innovative ideas around what we should do to tackle this important issue. That's why in May I hosted a virtual roundtable to hear directly from a diverse group of young people about what matters to them when it comes to mental health. Young people told me that they want affordable, culturally safe and inclusive services. If a young person asks for help, they should receive it in a fast and tailored way, no matter where they live. I heard about the importance of age-appropriate programs and services and a workforce that understands the issues that young people face. During this roundtable, I heard about how siloed the service system can be. If a young person is already connected to a service like education, housing or employment, referral pathways to mental health services should be a streamlined experience. In Victoria, we're getting on with this much needed work. We have announced significant investments in mental health services, totalling almost $195 million during this pandemic. This includes $6 million to Origin Youth Mental Health to fast-track their new digital platform, which is now providing online therapy and peer support to young people. We're also extending the hours of Headspace centres, increasing school-based mental health supports, and investing more in online and phone counselling services, including the Kids Helpline to help meet service demand. We're getting on with implementing the recommendations of the Royal Commission, which will provide us with a roadmap for system reform. Finally, I want to tell you about the work underway to develop a new statewide youth strategy. Last week, I launched a public consultation to gather feedback and ideas from young people, organisations and the broader community. It will build on what we've already heard matters most to young people, and this includes mental health. I strongly encourage each of you to have your say. You can make a written submission, complete a short online survey, or register to participate in an online youth and community forum. To find out more, visit the Engage Victoria website. I look forward to hearing your ideas. Thank you for your contributions and commitment to strengthening the mental health of young Victorians. I want to once again thank the Mental Health Foundation Australia for your work in promoting the mental health of all Australians. And I encourage everyone to consider attending the other events running throughout National Mental Health Month. Take care and stay safe.
We'll now be moving to hear from Emeritus Professor Bruce Tong, who will be providing an address on the issue of youth mental health. Prior to his retirement in 2012, he was the Foundation Head, School of Psychology and Psychiatry, and Head of the Discipline of Psychological Medicine at Monash University, and also the Senior Clinical Advisor to the Mental Health Program of Monash Health at Monash Medical Centre in Melbourne, Australia. He has a distinguished record of clinical work, teaching and researching in child psychiatry. He established the internationally recognised Monash University Centre for Developmental Psychiatry and Psychology. He continues to have clinical research and teaching interests in the areas of developmental psychiatry, with a particular focus in the areas of autism spectrum disorders and behavioural and emotional disturbance in children and adolescents with intellectual disability and neurodevelopmental disorders, parent education, and skills training public mental health interventions, as well as treatment outcome studies in childhood anxiety and depressive disorders. Please welcome Professor Bruce Tong.
Well, greetings. Greetings to you all from wherever you are in Victoria, around Australia, and in fact we know we've got international visitors to this important seminar. I acknowledge the traditional owners of the lands of Australia and the Torres Strait, and I pay my respects to their elders past and present, and to any emerging youth leaders in the Indigenous community who might be listening in today. It is indeed an honour if you have joined us. Distinguished guests, members and staff of the Mental Health Foundation Australia, particularly our Youth Advisory Committee, and all of you who have joined us, welcome. And I'd like to thank Natalie for being such a great coordinator of these ceremonies. Now, today we're going to talk about mental health of youth, but I've focused particularly on students or students in secondary school who are moving on to tertiary education. Now, of course, with the pandemic putting a cloud over many futures for young people, it is a time of stress. And although many are challenged by mental health difficulties at this time, I'm also mindful about how many young people are resilient and have met this challenge and are meeting it positively and making the best of it. And that will do them well into the future in terms of their own mental health. Now, we talk about mental health, but what is it? How can we define it? Well, I've got a definition up here, is that it's a state of well-being referring to our emotional, psychological and spiritual health and how we feel about ourselves and how we adapt and function to the best of our ability in the world around us. And because of that, it will determine how we work, how we socialise, how we love, how we play, and how we be creative. And with that in mind, it obviously impacts our intellectual, our social, and economic capital of the community. So it's incredibly important. Mental health in the community is vital to the intellectual, social, and economic capital of that community. Next slide, thank you. So if that's mental health, what is mental illness? Well, mental illness is complex. It is a complex interaction of disorders of the mind and the brain that significantly interfere with our thinking, our emotions, our behaviour, our work, our relationships and social life, and our physical health and life. In other words, it pervades all aspects of us. Next slide, thank you. Now, we've already heard that mental health difficulties are common. Certainly, a number of studies indicate that at least 1 in 4 young Australians aged between 16 and 24 in a 12-month period will suffer mental health difficulties. And we've also heard today from Natalie that under the pandemic conditions, that prevalence has increased. Of greater concern is we know that at least 1/3 of deaths in the 15 to 25-year-old age group are due to suicide. In other words, that's a major impact on mortality figures and leads the way in this otherwise very healthy period of life. The age at which most young people are in tertiary education is also the age of peak onset for mental illness, with mental and substance use disorders having their first onset quite commonly between the age of 24 and 36. So in other words, it's a risk time for mental health difficulties, even though it's also, for many young people, the time of greatest mental health and physical health. Now, if a young person does become troubled or upset or affected by a mental health difficulty, what mostly will it be? Well, predominantly, it's either a condition of depression or sadness and mood troubles, depressive disorders, or most commonly, it will involve anxiety, worry, panic, fearfulness, and also we see emerging difficulties with substance misuse, such as alcohol or other illicit drugs. I want to impress here that the research shows that not in all cases, but in most, if a person develops a substance misuse disorder, it is related to a pre-existing depression or anxiety. In other words, there is the opportunity for prevention of substance abuse disorders if we can treat depression and anxiety and eliminate it earlier. Psychosis, that is where people lose touch with reality, is much less common, although the time of peak onset of conditions like schizophrenia and other psychoses is in young adulthood or late adolescence. Early treatment is essential. Next slide, please. Now, moving on to consider tertiary education. And in that, I include not just university, but colleges of TAFE and further education, and also young people who are seeking workplace education, for example, in apprenticeships or other workplace-based training. So we're not just here talking about universities. Now, much of what I'm going to say will be again based on evidence from a very big study called a consensus study with Australian and professionals and consumers, and also information from a wonderful study done over in Ireland at the University College Dublin, where I was working for a short time to help them with this, called Student Mental Health and Wellbeing Policy. I'll also add some other information into my presentation, which has come from our own youth committee, who've had a number of workshops on this matter and have produced our youth policy paper, which is being released during this Mental Health Month. I encourage you to get a copy of that and to read it. Next slide. Now, out of all of this, there are a number of key points that emerge for tertiary education institutions which will help improve the educational outcomes for students with mental health problems. As Mike pointed out, this will also improve attendance and participation in tertiary education. Firstly, we're encouraging all educational institutions and other places of learning to have a policy that supports students with a mental health problem. Now, a number already do, but not every educational institution does. And that's a very important first step. The university should have a strategy for communicating this policy to all staff and students, and it must be ubiquitous and spread throughout the institution. The educational institution should provide support to students with a mental health problem. It's one thing to have a policy, but you have to enact it. And so this will require in big institutions the appointment, for example, of a disability office or a mental health awareness office and a range of other mental health and wellbeing supports and activities. Support services should develop a mental health promotion strategy which covers prevention, early identification, stigma reduction, availability and access to services. All of those, which I'm sure Natalie would agree with me from Vic Health, are a very important preventive activity. Easy access to these services is vital. No stigma must be attached to going along to the University Health Service to say, I'm not feeling too good, I'm not sure what's wrong, can you help me? Next slide. How do we facilitate improved educational outcomes for tertiary students with mental health problems? Well, firstly, we need to provide reasonable adjustment for students with a mental illness. Staff should be provided with information about making reasonable adjustments for assessments. The process for getting reasonable adjustments should be as simple and as possible, and advice should be available if students are needed. Now, we already have in Victoria some processes, for example, for allowing a student completing year 12 who has mental health problems to have special consideration in their examinations. And many universities also provide this. But the process for getting that special consideration is not always straightforward. The student may be embarrassed to try and find out how they get the application form. They may be troubled about how you fill it in. They may be worried about what they say on that form will not be kept confidential. And it may, they fear, work against them in the long run if they admit, for example, that they've got a current depression. So we've got a long way to go there. We also need to raise staff and student mental health literacy. Now, that's what we're doing through Mental Health Month. But again, there's a long way to go. Many young people I meet in my daily clinical practice have no idea about what mental health problems are. They're highly embarrassed. They feel that they'll be singled out. They're ashamed. And particularly young people from various culturally and linguistically diverse communities are really troubled and often will not seek help because of fear of shame and stigma. Next slide, please. So how do we facilitate improved educational outcomes for tertiary students? Now, this actually does require some staff training, and certainly institutions that do train their staff in some of these activities. But again, many staff in universities, if they're faced by a student with a mental health problem, really still don't have one idea about how to approach that. And we've got a number of, if you like, prompts or advice that we could give to teachers and university and education staff. The use of non-judgmental listening skills when talking with students about their personal problems. Now, that's difficult. People tend to want to jump immediately to an answer. I know what you should do about it, rather than just say, tell me, I'm listening. We need to know how to respond when a student discloses a mental illness to them, including which things are supportive and which are unhelpful. Things like, well, you should grow out of it, or why don't you wake up to yourself? Critical and unpleasant comments like that actually drive the person into further despair. So we need to respond in a non-judgmental and caring manner, and we need to listen. We need techniques for promoting motivation and self-esteem in students with mental illness. For example, and this is not just so for mental illness people, but it's so for all of us. We need to say positive things. We need to reward effort. You've made a very good start on this assignment. I'm really impressed with how you've read the literature. What I can help you with now is how to make a bit better sense of it and write it down, rather than saying, this is hopeless, I can hardly understand what you've written. We can always look for something positive to say to a student who makes some attempt at doing the job. Mind you, that's so in life in general, not just in schools, but in families and in our relationships. Look for the sunshine. We need to have curriculum design and delivery for inclusive and effective learning. Learning needs to have opportunities so that all can be included. For instance, I work with some young people who absolutely couldn't write a word in a sequence to save their lives, not because they're intellectually disabled, but because they have specific learning difficulties that involve writing. So what do we do with them? Do we say, go away? No, we say, you can do your work using voice recognition technology, or using a scribe in examinations, or talking, having an oral examination instead of a written one, learning in other ways, listening to audio tapes rather than reading. Classroom examination and assignment adjustments for a student with a mental illness need to be tailored, particularly examination. For example, some students benefit from having their examination taken in a quiet room with no distractions. Some students need break time if they get overwhelmed with anxiety, so that they can get up, walk about, get themselves together, and then get on with the job and show what they're really made of. We need to make students aware of their rights and responsibilities, and of course this involves active working with student groups, like we're working with our Youth Advisory Committee. We have to listen to the voices of young people. And staff, if possible, need to know how to handle mental health crisis situations. I can't go into this today, but for example, the Mental Health Foundation Australia does run mental health crisis first aid courses. And there are other mental health crisis first aid courses available online elsewhere. After all, most university staff are encouraged to do a first aid course, but that first aid course really just relates to broken bones and cut fingers. It doesn't relate, unfortunately, at this stage, to mental health crisis, and it's important that we introduce that into tertiary education life. How do we facilitate improved educational outcomes for tertiary students with a mental health problem? We need to interact with students with mental illness in a manner that maintains respect, dignity, confidentiality, and equity. They're very important words. Respect, dignity, confidentiality, and equity. For example, if a student has a mental illness, staff should not make assumptions, but rather ask the student what support they might need. Staff should explore challenges or barriers to successful learning with students with a mental illness in a non-judgmental way, and make it certain to that student that you are trying to find a solution. We need to allocate resources to services and evaluation. And this is important. If an institution has no resources in the background, then it's very difficult for them to respond. The institution's mental health services should be subject to ongoing research and evaluation of their service provision. An institution might say, yes, we've got a mental health and counselling service, but nobody's ever looked at it to see whether, for example, the students respect it, whether they use it, and whether they find it helpful. It's very important that we evaluate and look critically at any clinical work we do and provide. We need to allocate resources carefully too, so that they're best used and not wasted. Next slide. So what about students with pre-existing mental illness and disability? In other words, students who already know in their high school years that they've got difficulty, for example, with panic or with fearfulness or with anxiety. And it's very important that there's communication with professionals who know the student in order to provide relevant information and develop a transition plan. Now, when we think of childhood, for example, preschool teachers are very much in tune with the need to have a transition plan to help the 5-year-old child move from preschool to primary school. But does the same happen between secondary school and tertiary education and post-school options? Often not. And yet a transition plan worked out between the young person themselves, their existing teachers and family, and the institution to which they're going will make a world of difference. And it is probably the most important thing which will ensure university and learning engagement and attendance. Next slide, thank you. This is just showing that cog of interactions I've been talking about. With student consent, you need to bring together a transition team which will comprise the parents, if they're still around and involved, and hopefully they will be, the student, and the teaching team from the previous and the current institution to where they're going. Sometimes it only requires a 15 to 20 minute roundtable conversation where the student and the previous educators talk about the special needs. The new institution listens and says, yes, we'll do X, Y, and Z, and it's all underway. So it's not complicated, but it has to be done with thought, and there has to be intention to provide a transition plan for young people with mental health problems who are going on to tertiary education. Next slide. Now, why do some young people not seek help? We're aware that that is very much the case, and there are a number of barriers that we're aware of. The first one, and is very understandable, is that the young person will fear that they might lose control and that there'll be breaches in confidentiality. And that's a big fear, and of course it's enough to stop someone seeking help. Stigma and embarrassment rear their ugly head. Stigma is still prevalent. It's perhaps less than it used to be, but it is still out there, alive and well. And is the same process in human beings that involves racism as well. And that all leads to shame and a lack of seeking help. Problems recognising symptoms. For example, a young person, I meet young people who just feel awful and they think it's their fault because, you know, they think that they must be stupid, that they don't play football anymore because, you know, they're sure that they're really not very good in football games, even though nobody's told them that. In other words, they may be depressed, but what they recognise about themselves is not that they have a mental health problem and an illness, but rather they recognise the symptom of that, and that is that they're useless. And so they won't seek help because they think nothing's wrong with me except that everything's wrong. So there are problems recognising symptoms, and that comes back to how we need to increase mental health literacy. We need to talk about, without shame, mental health difficulties, just like we might talk about diabetes or asthma or allergies, or the football, or whatever else you want to talk about in ordinary conversation. Also, young people very appropriately have a preference for self-reliance. That's one of the hallmarks and features of young adult life. I can do it. I must be reliant on myself. I'm no longer at home. I want to show my parents and everybody else that I can get on with it. Well, that's fine if you're in good mental health, although even then, you need help at times to be self-reliant. It's a learning process. So that can get in the way of seeking help. Fear of failure or discontinuation of course, or course expulsion, or even fitness to practice. I know a number of medical students who are very ashamed to talk about mental health difficulties because they think that even before they become a medical doctor, they're going to be banned from the medical registration process, which of course isn't the case. But they fear that, and that stops them seeking help. We must be aware of these so we can counteract them. Next slide. What are the ways forward? We need to provide strategies for improving mental health resilience among young people, acknowledging their desire for self-reliance. We need to provide programs to increase students' mental health literacy. We need to provide programs that are designed to reduce stigma and that is associated with mental illness and prevents help seeking. Next slide. Okay, and now this is tips for staff in institutions, but it's not just tips for staff, actually it's tips for all of us. If we meet somebody who has a mental health problem, how do we communicate with our friend, our boyfriend, our girlfriend, our partner, our mother, our father, a student at school, a teacher? How does a teacher communicate with a young person who has a mental health problem? These are the tips. Be supportive and empathic. Tune into them. Don't share your own problems. Oh, you say you're depressed. You've got no idea. Now, let me tell you about how 2 years ago I was... That doesn't help. Sometimes people think it might, because it might mean that that person you're talking to will think, oh, they know all about it. But in fact, don't share your own problems. Certainly don't be judgmental. And as I said before, listen rather than give advice, even though it's a human response to try and tell somebody what to do. Most importantly, ask the person how you can help and who else might need to know. And you'll be surprised sometimes by the answer. Now, how can I help? And who else might need to know you're feeling like this? Well, what you could do to help is, I know my mother needs to know about this, but I don't know quite how to tell her. But I know she knows you, so perhaps you could say it for me. Consider reasonable modifications to reduce workload and study stress and compensate for any disability. Provide information on where help is available. And if ideas of suicide are communicated, take it seriously. It's never a joke. And facilitate contact with student health services, with the GP or a crisis service, or the college or university guidelines on mental health policy. And I just remind you all that if anybody is troubled by listening to this presentation, that help is available on the Mental Health Foundation Australia helpline, to phone other organisations like Lifeline or Kids Helpline, or importantly, perhaps go to your GP. And it's important for young people, even though they may be healthy, to always have a doctor so that they can have an annual health checkup. So go to your GP or to other community health clinics such as Headspace. Finally, if somebody asks you for help and they've got a mental health difficulty, remember you are not the therapist. You don't have to take that role on, and in fact it could be very tricky and even dangerous to you if you tried to do so. Next slide. So there we are. How can we promote the mental health of tertiary students or young people moving into the workforce and into further education? If we can promote their mental health, then we're promoting a better future for the entire community and for those individuals for the rest of their lives. Thank you for listening to me.
Perfect. Thank you so much, Professor Bruce Tong, for that speech. That's really insightful with a lot of great detail about all the things that students are dealing with always, and in particularly this year, that are making things quite difficult. So we're now going to move on to a panel discussion with Professor Bruce Tong, but he will also be joined by Senior Sergeant Ingrid Ebert from Victoria Police Youth Initiatives, and Harleen Gandhi, who's a school counsellor. Sorry, I'll just get that up quickly. So, Ingrid Ebert is an officer in charge of the Proactive Policing Unit and the manager of a police mental health portfolio for Stonington and Port Phillip, as well as the PACER, Police and Clinical Early Response Police Manager. She has recently conducted a review of police response to mental health incidents and provided information to the Royal Commission into Mental Health. She represents Victoria Police as they collaborate with Alfred Health and other mental health service providers to establish the best possible response to mental health crisis in the community. Harleen Gandhi is a qualified counsellor who has been working with youth for over 5 years in a range of settings. She has experience working with those from refugee, asylum seeker, and trauma backgrounds, those with family and peer issues, those with a range of mental health concerns, and those with high-risk behaviour. She spent a significant amount of time at Lifeline responding to and supporting crisis callers and those in a high level of distress. She has also worked extensively with women and children experiencing family violence and worked in a first responder organisation. Her current role is working with young people from ages 12 to 18 in an education setting where a high number of students are newly arrived to Australia with high and complex needs. In regards to the questions, please enter your questions into the Q&A boxes with the names of the panelists you would like to direct your questions to, or if it's just a general question to all of them, feel free to leave it unnamed. So, welcome to our panelists. Thank you so much for joining us today. The first question for you all is, do you think that it has become very necessary for the topic of mental health to become an essential part of introducing and entering into the curriculum for the academic stages, coming from the primary to the finished grades, and studying it in schools in a manner that prepares the younger generations to interact with what's caused by coronavirus and its future effects, and on the distant advantage? So basically, yeah,
Well,
do you...
Yes. Who's talking, Andali? Are
Yes,
you,
I am. I'm reading the questions to you from the question and answer box.
I think I heard somebody begin to answer that. If not, I've got a comment. But did I hear any of the other panel making a comment on that? Okay, well, this is similar to another question I noticed that came up on the chat line. And so I'll at least get the conversation going about this. And it's a question about whether there should be, I think, in school education curricula, topics about mental health and particularly about mental health literacy, if you like, making people aware of mental health difficulties. Well, it's quite obvious what I'm going to say about that. Yes, of course, it doesn't have to take a huge amount of time in the curriculum, but it could easily be slotted into a number of other existing programs in curriculum that have to do with life education. I know some schools already have this in their curriculum, but that's would be an excellent place so that they can learn about mental health literacy, about issues, for example, about substance abuse, about social engagement, about antisocial and social behaviour and so forth. Over to other panel members.
Hi everyone, so my name's Harleen and I work in a secondary school currently. I think it's really important to have it as part of the curriculum. I've been quite lucky in the schools I've worked in where I've been given scope to work with a lot of students and deliver a lot of sessions on what is mental health and how to access support and where to go and what you can do. But I guess that's been not something mandated as per se by curriculum. It has been up to the school's choice. And I think it would be really effective to have a bigger scope. A lot of my work is often working with young people and they come in and say, my friend at another school or have got a sibling in primary school or a relative, and they're worried about them as well. So I think it will be quite an effective sort of thing to have, I guess, a whole school curriculum where all schools are delivering similar content, and everyone sort of has a lot more education from a young age of what they can do and where they can reach out to.
Can I also add there, I'm certainly not an expert in secondary or tertiary education, but certainly as police, we have increased our training for all our members coming through, recognising it as absolutely a priority, both for when we're dealing with members of the public to consider their mental health, but also we've got a huge priority on educating members for their own mental health and just, you know, living in the world that we do at the moment, and how to look after your own mental health, or to, I guess, recognise when you need to work on your own mental health. So although it's a different setting altogether, we as an organisation definitely would support the idea that mental health needs to be front and centre and it needs to be prioritised.
Some great responses there. Thank you guys so much. The next question is, how can we mobilise our government to include the youth strategy as a part of our Local Government Act?
I might just begin with that. In some of the schools that I've worked with in their local governments, they've all often had local councils and local government run youth groups and youth programs. A lot of local councils have youth centres which are funded by their local council, so like the City of Casey or City of Dandenong. I think it's really important for young people to be part of these groups and to, where they can, join in. Even local centres like Headspace often run forums for sort of youth-driven initiatives, and I guess this gives the opportunity for young people to talk about what's actually going on, what's happening at the grassroots level, what's happening with them, what are they noticing, what do they need help with, what do they think bigger services and organisations can help with. So I think that if there is something that you find particularly important to discuss, or you find isn't being addressed, those platforms give you really good scope to do that. And most of these, I guess, committees are available for young people to join up till the age of 25. So if you feel as though maybe now is not the right time for you and you prefer to do it later on, there is scope. And I guess working in a broader network, I attend a lot of local network meetings and I work alongside a lot of schools and agencies in my area, and those forums that young people attend actually give us sort of an insight as to where I guess the gaps are and what we can do to try and address those gaps. So personally, we have found those to be really helpful, and if you do have something that you think is valuable to contribute, I would consider, or recommend for young people to look into that and become part of that.
Well, I think it's a really difficult question, isn't it? And that's what I guess we're hearing about today, that government and policymakers have a lot of competing issues, particularly at this time of pandemic, balancing budgets and all the rest. And there are lots of lobby groups out there. There are lots of people pushing for this point of view and that point of view. So how do mental health issues get up there? Well, we've got a Victorian Royal Commission at the moment. Now, none of us exactly know finally what that's going to say, but many of us are hanging out for that, including, I know, the Foundation's Youth Advisory Committee. They're very keen to see whether youth get a mention. There has been some support already provided to youth mental health services, and we heard today from Ms. Spence about that. So things are looking positive, but I think it's a question of continuing to agitate and speak about it and not give up about it. And particularly, I'd throw down that challenge to young people. Our Youth Advisory Committee is active in talking to politicians and policy people. And I know there are other groups that do that. So all of you young people that are listening, if you think that this is important, write to your local member, send an email, contact them through social media. Don't let it rest. Say, listen, we listened to a seminar today, and did you know that? That's the way the message is going to get through. So I thank the person for that question, and would encourage the person that asked the question actually to be active as well.
Yeah, certainly. Ingrid, do you have anything you want to say to that or add to that?
No, that's not my area of expertise. However, as youth resource officers, I know that at the police station, a lot of the youth resource officers are involved in some of those committees that we were talking about before, and absolutely we receive feedback from those forums and committees about police interaction and how that could be improved. And certainly a lot of that was considered when I was doing the review, and how we can better respond. So the information that is provided is listened to and is acted on.
Yeah, certainly. And I will just add as well, as someone who has had a lot of experience in the area of advocating towards politicians and everything myself, for anyone that's listening, if you see an issue that you want discussed, do not hesitate, write to your local MP, send them a call. It makes so much more of an impact than you think, and especially personal emails that you've written, it has such a great impact, and you will be surprised the amount of times you get a reply, especially if you and a group of friends get together and you do that repeated and regularly, you will be noticed. So definitely, great question. So the next question is for Bruce in particular. Although youth mental health issues are more common in teens and adolescents, would you say that the progress of better mental health outcomes starts from a much younger age?
Yes, thanks. Well, I saw this question too that came up on the Q&A and chat line during this presentation. And it's a question that's very dear to my heart. In fact, last night at the opening of Mental Health Month, I did speak about youth mental health, but I talked about how youth mental health is important. It's a vital time to intervene and prevent and to provide early intervention, but it is best built on mental health during childhood. And we do know that some of the most powerful evidence-based preventive things we can do to promote lifelong mental health are actually things we deliver early in life. And by early in life, I mean in the first 3 or 4 years of life. And there are 3 things. One is that if mothers and their partners are provided with support and education and a certain amount of training, if necessary, about how to relate to their new babies, and where attachment between mother and baby can occur in a safe and stable environment, then that is a good start to life and promotes mental health and resilience. So in other words, we need to attend to the support we provide for families and their new babies to promote attachment. The second is that if parents are provided with education about how to support and manage little children, their behaviour, their growth and development, then that also promotes mental health and well-being in the child, but also, interestingly, in the family, even to the extent of it being economically of value to the family. Parents who've had education and skills training to manage their little children, for example, 5 years after that intervention, are more likely to lose less time from work than others. In other words, it even can have an economic benefit like that. We're not here saying parents are to blame for the mental health problems in children. That's not the case. But parenting's complex, and we need to recognise that. We all need education and help with how to do it best. The third thing is, and this is early life, at least 2 years of quality preschool education. Something as simple as that, or is it simple? No, it's not, but that can lead to long-lasting positive benefits for children. So the answer is quite simple. A mental health promotion is something that starts early in life and then should continue throughout life. It's necessary for the elderly as well. It's certainly necessary in adolescents because, as we've heard, certain mental health illnesses have their rate of peak onset in late adolescence and early adult life, and that needs to be taken into account. But we start early and we continue the process. So thanks for that question.
So I've got another question for you specifically, Professor Bruce Tong, and that is, how can tertiary institutions specifically support students entering into a new environment away from home, such as university accommodation, for example? And of course, as well, if any of the other panelists have something to comment on this as well, please do feel free to.
I'm wondering whether Harleen might have some views about this. You're nearer in age to that particular question. It's an important one, isn't it, Harleen? And I think Ingrid probably has seen situations where young people have left their home in the country and have come down to Melbourne and haven't found very safe accommodation, and before they know it, they're in trouble or on drugs or things like this. So, I mean, Harleen, do you have any views about how we can help young people when they move away from home into other accommodation to go to educational institutions?
Mm-hmm. My perspective is always, I guess, strongly focused on advocating for education, because I've worked with youth for a number of years now and in an education system. And I think in the last probably couple of years, 2 or 3 years, we've had a big support network created through the Department of Education in establishing, I guess, working parties that aim to ensure young people are not disadvantaged in their education and that they do have access to, I guess, all services and all platforms of education that other young people who are in different situations would have as well. I would say perhaps your first point of call could be a place of education that you are interested in, and contacting them, letting them know, I guess, about the situation, because we have a number of, as I mentioned, working parties to support you with that. But also your local, I guess, youth services and youth centres have good connections with your local schools and tertiary education settings, so TAFEs and universities. And a lot of TAFEs and universities we work with, like, I guess, to have a little bit of information about the young people coming in to them. So it can appear when you're going on to TAFE or uni or work that you're going to this big wide world, and I guess people won't know about you or what you do, but actually we work very closely with those places, and a lot of the time they want to know how they can best support young people. So if you are comfortable reaching out to someone and letting them know what's going on and I guess the difficulties that you're having, there can be a really big support network established around you, with a lot of different services that can come in and support you. And there are a lot of agencies out there now that are created specifically for young people who are not living at home, or who have moved out from another country or from their place of residence, and there's a lot of things in place. But I guess it's feeling comfortable and being able to reach out and let someone know what your situation is, and that person should be able to hopefully direct you to the resources best fitted for you.
I would support that as well, and also say that from when I was listening to Professor Bruce in his presentation before, one of the things was to commit to a transition plan, so that you've got those contacts before. However, we also find that as, again, I've mentioned youth resource officers, I note that one of the things that the professor was saying was that there is a bit of stigma attached to it, and perhaps young people don't want the actual organisation where they're going to have any preconceived ideas about what this person's going to be like when they get there. So one of the things that we like to remind people is that most police stations, if they don't have a youth resource officer actually stationed there, they will know who the local one is, maybe at a neighbouring station, and that we have relationships with, you know, so many mental health services and referral options. And so whether it's mental health or whether it's a query about being in a new town, a new position, coming across some conflicting situations that they're concerned about, a local youth resource officer at a police station is a fantastic place to start. You don't have to have a list of every possible agency around. If in doubt and you want to contact a youth resource officer, they're not going to be able to specifically necessarily help you with that issue, but they've got the contacts and the referrals to all the other agencies that they can absolutely point you in the right direction.
Yeah, that's such good advice, isn't it? And as far as I'm aware, virtually all the universities and TAFE colleges also have a counselling staff and integration or transition workers who know about accommodation and where that might be available and can provide advice. But it does take that step of asking, doesn't it? And that might be the barrier. And going back to what I said about transition, and I agree with you, Ingrid, it's much better to plan this ahead and have a good transition plan rather than just on the first day of university rock up to Carlton, having come down from Mildura with nowhere to live. Then you're in trouble. So plan ahead.
Great advice. And it's also a really good sign as well, just to take note that the way university accommodation is set up from the inside perspective as a student who uses university accommodation is they're being set up more and more as an idea of communities where you've got support hubs within the accommodation to help you with these things, people calling on you and checking on you. And so it's no longer just a case of you move into university accommodation and then that's it, no one's touching base with you. So there is an increasing instance of universities setting up accommodation specifically with the goal of it being more like a community hub than anything else. So it's really great progress to see. The next question is, adolescence is naturally a time of turbulence and adjustment. Where is the dividing line between normal emotional risk-taking and behaviours indicative of compromised mental health?
I could suggest, perhaps given the time, and Ali, that we could perhaps combine that with, I think, the last question I can see, which is about antisocial behaviour. In other words, does antisocial behaviour, which can sometimes involve risk-taking and what people sometimes see as normal, energetic adolescence, when does that become a problem, and does it indicate any future difficulties? I'd be interested to hear from Ingrid what she thought. Does if you see young people out in the street who are taking risks or are being a bit delinquent or antisocial, is that a sign of mental illness, or is it a sign of a disastrous future ahead with all sorts of difficult problems, including prison and drugs and all the rest of it?
The short answer to that, I would say, is no. Just because somebody does get involved in some sort of risk-taking behaviour is, not an indication that they are going to be a career criminal. Certainly, as far as police are concerned, we don't pretend to be mental health experts, and that's not our job to be. We would get involved if someone was identified as having committed a crime, and yes, we would be attending, and whether it's arresting someone or just getting their details so we can follow up later on. But when we do attend a crime, especially if it's somebody's first offence or if there's obviously some other things going on, taking someone to court and putting them into what we call the system is not our only option. We have so many other options that we would be prioritising, especially for young people who it's the first time they've come to police notice. Especially like we were saying, if they've moved from the country or something, they've got other things going on in their lives. So whether it's through court or whether it's it doesn't even get that far, police have other options. We would prefer, for example, if there was drugs related or drugs involved and it was a first offence, we would much prefer that the young person got into some sort of drug counselling. And so we have the option of what we call drug diversion programs. And we would always prefer that a young person takes those kind of options as a first port of call. We also just have, no matter what the result is criminally, every young person or every person that would come into custody or to our attention out on the street, we've got the options of an absolute suite of referrals, whether it's you're having trouble with accommodation, whether it is mental health, whether it's food, whether you need assistance with anything. We've got basically referral options for local services that can provide all that kind of support. But once again, we have to be aware of it, which we're not necessarily, by meeting you for 5 minutes, we don't know all that. But again, it's being prepared to ask for that assistance and pointing us in the right direction of how we can help you. But yes, we understand that young people make decisions, and it's 100% our intention to make sure that a few wrong decisions in your life don't define your path. And it's no benefit for us to hammer you into the ground for making one bad decision. We would much prefer that you learn from it and so make better decisions in future, so we're not continually being called to the same places for the same crimes.
That's a really great answer, Ingrid, and it kind of touches on another question actually that's come up, and that's a question for you regarding what are some of Victoria Police's youth initiatives and how do they contribute to the better mental health outcomes for our youth community?
Sorry, I missed that. I missed the start of that question. What were some of the...
Yeah, of course. So the question is for you, and it's what are some of Victoria Police's youth initiatives and how do they contribute to better mental health outcomes for our youth community?
Youth initiatives, we don't specifically have specific programs that are offered statewide. You'll find that local police will have relationships with their local youth services. They'll have relationships with schools, any sort of youth agency, mental health agencies, and together they will decide what's appropriate for the young people that are actually in their area, what they need. But we do have one of the ones that, because I'm Stonington and Port Phillip, So one of the ones that we've got at the moment is a partnership with Headspace, and it's very specifically in relation to suicide response. And one of those things says, one of the reasons that exists is because we know all the statistics say to us that when a young person suicides, the people around them, whether it's the people at work, their friendship group, online friends, we know how much more at risk they are following one person's suicide. So rather than wait for other people to be at risk, we've got a program that we all share basic information about the fact that a young person has died by suicide, and that sends all the other agencies into action. They've got social media experts, they've got youth workers that attend schools, ones that can work with the family to identify anyone else who might be at risk, and to get in there early and make sure that they are looking after their mental health. So that's one. I know that happens, I'm pretty sure that happens out in Casey. I know that it happens in Frankston, and it now happens in Stonington and Port Phillip as well. But again, they're the sort of things that happen when we're aware of specific issues that are relevant to that area.
Yeah, great answer there. It's a lot more complicated and complex than might have first thought, definitely. Now we've got a question for Harleen here. From your perspective, how significant are mental health support services in schools? And would you recommend greater funding to deliver more services through school counsellors or education?
I think, so could you just repeat the first part? I just missed the first part.
Yeah, of course. So from your perspective, how significant are mental health support services in schools? And would you recommend greater funding to deliver more services through school counsellors or education?
Okay, I think it's really important. I guess it's a bit of an area where not all schools are funded for support services for mental health and for students. It is an area where it is up to a school to decide how they wish to focus on their students' mental health and wellbeing. There has been, I guess, a bit of a boost in initiative last year. The government did announce an additional amount of funding for schools to have a mental health clinician come into every school. So this is a rollout process. So some schools have had their clinicians put in from last year, and some will be receiving them throughout this year and next year. I think this is a great initiative through the government, because this isn't, not all schools have access to having school counsellors or mental health workers. And this ensures that every school in Victoria will have a clinician that students can access. I do think, or I do wish that there was more funding around this, because the number of young people that I work with, even sometimes, within the team I work with, we can sort of get to a point where we go, we wish there was more of us. I do think it's a little bit of an area where it's great that a lot of young people are more aware of their mental health and their well-being, and there is a lot more talk and a lot more resources out there. And because we talk about it so much more, and because young people are more aware of what's going on for them, their family and their friends, there has been a bit of an increase in the services and young people accessing them. Does that sort of answer what the young person, the attendee was asking?
I think it does, yeah. It's just regarding, what your opinions are on the requirements for more funding and for school counsellors, and such a great answer. So we do have one more question. There's a lot of really great questions in there, but we only have time for one more. So there's a lot of questions regarding how can young people seek that additional help. I'll include more specifically. How do we account for students needing help in school environments where they are particularly not accepting of their circumstances, contributing to their mental health struggles. For example, students in the LGBTIQ plus community in schools that are not safe schools or accepting of a range of sexualities or gender circumstances. How do you help students with those specific circumstances access that mental health assistance within schools when there's already stigma around mental health alone, without these additional barriers that they may face with discrimination within their school?
I'd definitely be speaking to the young person one-on-one in a lot more detail, and I guess trying to work out what's going on for them and specifically what struggles they're having. I wouldn't want to assume or generalize what they're experiencing based on some other students' perspectives. I think it's really important to always speak to the young person and focus on what's actually happening in their world. There can be a lot of stigma attached to, I guess, being part of a rainbow community, or they might not feel safe in their school environment. It is unfortunate, but it is something that I've worked with other young people before. If they were comfortable or, I guess, wanting extra supports, I would be happy to work with them in maybe reaching out to supports in the local community that specialise in working with someone who's LGBTQI+. At times I have been able to make arrangements for external services to come into the school and meet with a young person in sort of a confidential environment in a safe space that they can talk to with maybe someone from another agency or organisation. If the young person does feel comfortable, maybe even just with one teacher or one staff member at the school, you might be able to reach out to them and let them know what's going on for you and where you're struggling with, and they might be able to get in touch with local services. As Ingrid has mentioned, most schools are part of lots of networks where we work closely with the police, Headspace, other youth services and centres, and through that we have a lot of I guess connections in what is out there for young people. And so if something isn't available to you, maybe, or you're not aware of, I guess, what's available at school, there's always lots of other agencies and services that we can connect you with that might be a better fit and create, I guess, a bit of the change that you might need at your school as well. But I guess the first step would be reaching out to someone, and it doesn't have to be someone at school, it can be someone in your community. There's a lot of online platforms now as well, a lot of like e-chat services that you can connect to, and they can connect to your school if you give them permission to do that. And that way, I guess you don't have to be the sole person kind of making that big step. You can have someone co-facilitate that step with you and maybe work through with your school some solutions or ideas that might help to make it a bit more of a safe environment and a bit more welcoming, not just for you, but for all your peers and other students that might be in a similar situation to yours.
Certainly. Do any of the other panelists have anything to say in regards to that question? And I guess accessing services as well as, you know, the regular levels of stigma you're attached with when you're accessing mental health services within a school, but also dealing with additional levels of stigma or discrimination depending on where you're attending and what the environment is like for you and your circumstances.
I would certainly add that one of the things that we talk about, especially when we're learning how to make referrals and what appropriate referrals are and how to go about them, one of the things that we re-emphasise is that it's so important that the young person is comfortable and feels like they're getting what they need. And so it's not unusual to try one place, just not be happy and need to try somewhere else. And that's completely okay, and it's completely normal, and everyone does it. And one of the things that I've had really good feedback on is the app Ask Izzy. People may already know about that, but if you don't know it, it's a fantastic, actually, when I say app, it may not be an app, it may be a website. But Ask Izzy as in IZZY. And so you can make a lot of those pre-referral inquiries yourself. You can just basically you put in your postcode and what your issue is, and it gives you a whole heap of options of different places you can start to get some assistance for that. And if you're reluctant to, if you don't feel safe to make those verbal inquiries or in-person inquiries, it could be something that just gives you a little bit of confidence if you have a bit of a click around a website like that to realise how much support there is available, and at least be a starting point that you can initiate yourself in a safe environment.
Yeah, perfect. And Professor Bruce Tong, do you have anything to add before we wrap up the panel discussion?
No, I think that they are very good answers. It comes back to our absolute need to eliminate stigma. This is not just a response at a local and individual level, but it has to be fully supported right to the top of government and bureaucracies in education, without a doubt. And it particularly has to come from the top of schools. The principals need to be right behind these policies, otherwise it doesn't work. So unfortunately, if the principal's not, then that school can have a problem.
Certainly, some really great responses. Well, thank you all so much for talking on the panel discussion and your contributions today. I'd just like to kind of wrap things up for all of us by first, on behalf of the Mental Health Foundation Australia, thanking our speakers today, Martin Kravosha, Mike Hutton, Squire from Australian Unity, Natalie Russell from Vic Health, the Honourable Ross Spence, Emeritus Bruce Tong, Senior Sergeant Ingrid Ebert, and Harleen Gandhi for speaking today. I'd also like to thank everyone for attending today and listening to what all our speakers had to say, as well as everyone in the Mental Health Foundation Australia team for making this happen. It's been a wonderful event, and I know I personally have learned a lot, and I'm sure everyone attending here today has. We do have some thank you pens to present to our speakers and dignitaries for today. Unfortunately, I don't have them with me, so I can't show you what they look like, but you will be receiving them in the mail, and we are very thankful for your attendance today and your contribution to this discussion that we've been having. So thank you all so much for attending. I hope you enjoy the rest of your Friday and your weekend to come. And yeah, I guess we'll close it off there.